As a physician, I know how COVID-19 has disrupted practice routines and added significantly to our list of concerns. We have to remember that our patients and their families are going through the same thing. Many teens are adjusting to modified school schedules and a host of other disruptions to their typical experiences. They're worried about their jobs and they're worried about their families. They feel and experience the stress placed on their parents, their teachers, and their friends as their own. Now more than ever, adolescents need our support.
Our nation's youth are experiencing unprecedented social isolation, illness and fear within their families, and an upheaval of the structures that brought resources, supports, and meaning to their lives. Depression is a common problem among adolescents that has only been exacerbated by the current pandemic. The good news is that with appropriate treatment, most teens make a full recovery from depression. The bad news is that most cases of adolescent depression go unrecognized and untreated.
As overwhelmed as we physicians feel, know that young people in our communities are also struggling, and they don't often know where to turn for help. That's where PCPs come in. In these times, recognizing and treating adolescent depression can be a life-saving component of the care you offer in your practice every day.
Integrating behavioral health into primary care is a highly effective way to reach young people, particularly youth living in rural communities. Yet, currently less than 1% of teens are routinely screened for depression during primary care office visits. To address this, we've developed a new program, Responding to Adolescent Depression through Integration in Telemedicine, or RAD-IT, to assist small primary care practices in Michigan as they introduce integration.
RAD-IT is a free program. It offers training on universal depression screening for adolescents aged 12 to 18, evidence-based treatment protocols, and established links to pediatric behavioral health specialists.
The RAD-IT program comes with a number of benefits to your practice, including a dedicated practice coach who will provide customized support, an online toolbox of resources, tailored behavioral health referral guides, and access to a network of more than 100 behavioral health providers specializing in the treatment of adolescent depression. You'll also receive 30 to 50 continuing medical education and/or maintenance of certification credits, assistance with optimizing billing and reimbursement, and more than $5,000 worth of HIPAA-compliant telemedicine equipment. Space is limited. We can only accept 15 practices into the program. If you are a clinician in rural Michigan serving adolescents, please contact us today to determine if your practice is eligible.